Welcome back to the Derm Expert Podcast. Today I'm joined with Autumn Newman.
Hello.
Again, thank you for coming back.
Thank you for having me.
Talking with us today about common trends in dermatology. Last time you were here, we talked about acne, which is definitely a hot topic, something that we treat all the time. But trends, I think, are fun to talk about because I think that, it's something that, for us as clinicians, we stay up on. But, I think with social media and access, I think patients stay up on what trends are too. So I think to be able for us to talk about these things with each other, but then also for our listeners, and I think that it's a good way for us to, really kind of bring to light some of the things that we're seeing in the clinic.
I agree.
Yeah. So let's start first with cosmetics.
Okay.
So cosmetic procedures, obviously that's not a new thing, but I think this mentality of keeping a natural looking face, a natural approach to treatment is definitely something that I think that patients come in and they are requesting more of that now. What do you think?
Totally agree. I think long gone are the days where you want that overfilled, frozen look. I always tell people you want things to look as subtle as possible. Like you want someone to think, wow, you look really refreshed, not, wow, you look overfilled.
Right.
And one of the comments I recently posted a video on Instagram about a filler patient, and one of the comments said that they couldn't really tell a difference, but they don't know what to look for. And that's exactly what we go for.
Actually a compliment.
Yeah.
That was a compliment to you as the injector.
Super subtle, but just a nice, healthy glow.
Yes.
So, yeah.
In fact, so much so to the point where now I think when patients come in and maybe they've had some filler or they've maybe been overfilled, it's not uncommon for us to have a conversation with our patients about maybe let's dissolve what you've had done. Let's dissolve it and let's start from scratch so that we can we can build a more natural look.
Yeah, completely agree.
Yeah.
I did that today.
Did you?
Patient. Yeah.
I love that.
Dissolve some lips. We're going to wait a while and then give her a nice, fresh, natural appearance.
And I think patients, while they probably don't love the thought of being dissolved when they have invested money, they've invested time into having things injected and looking a certain way. But I think it's also important to understand, too, that if, another injector is taking over and we're walking into, something that a patient has already had work on, it's like an artist walking in and painting on someone else's painting.
Yeah.
It's something, I think that can be best done when we start from scratch sometimes.
Completely agree.
I think it yields better results.
I agree.
So regenerative medicine.
Yes.
So this is something that I think is talked about a lot now. I don't know that I really think it's all that new, but I think that this is a topic that is getting so much more exposure, so much more attention.
Right.
Biotech treatments or biotechnology, it's referred to. It's a process where these ingredients are produced in a really controlled environment in a lab. And these ingredients, they mimic what are found in nature and what we have in our bodies.
Right.
Things like exosomes, growth factors, peptides, fermented ingredients. These are things that I feel like patients now are hearing more about.
Right.
Talk a little bit about your thoughts on these products,
I think it's
on
great.
these ingredients.
I definitely think, SkinCeuticals is a line that we carry in the office. I think a lot of their products, they've really integrated the, like we were talking earlier today, the licorice root, the purple rice, what those ingredients just in particular can do for dark spots, helps to hydrate and plump the skin. If you do or use products like that in combination with just a good skincare routine, the results that it can yield are definitely what patients are after.
Yeah, I think it's interesting because this is an area that, when you start researching it, you can really get involved in what exactly are these products.
Right.
And I think it's important for us to talk a little bit about, a little bit more detail about what are the differences in these? What do we see, when we're talking about exosomes with patients? I think it's important to make note that there are plant-based exosomes and growth factors. There are human-derived growth factors, human-derived and plant-based products that are in growth factors and exosomes. Exosomes basically are little tiny sacs that cells release to signal other cells to regenerate, whereas growth factors are real specific proteins that stimulate cell growth and repair. There is a product on the market right now called Plated. Talk a little bit about what Plated is.
So I'll be honest, I hadn't looked super in depth about plated. And then we had mentioned that we were going to have our little outline for today.
Yes.
And that is actually derived from actual human platelets,
Right.
which, I mean, it's called
Comes from a blood
plated,
bank.
So, yeah, it makes sense. But I had no idea.
It's interesting, though, because I think like most patients, they see these products on the shelf.
Right.
They go to a med spa or to the dermatology office and, they're sold a product. And I don't know that patients always really know what's in it.
No.
What am I buying?
Right.
How is this helpful?
Right.
But recognizing that, these products that either come from plants or they come from human, whether it's human stem cell or like in this case with plated, it comes from a blood bank and their platelets derived from those blood banks.
Right.
Those products, while they are safe, I think it's important to understand sort of where do they come from?
Yeah.
How can those things be beneficial? We do see that it helps to reduce inflammation. It accelerates the healing process. Right. So post-treatment, post-procedure, really good things to be able to use and incorporate. But I think for consumers, it's good for them to be knowledgeable of what are these products derived from? So what kind of questions do I need to be asking?
Exactly.
Same is true for these growth factors, these proteins that stimulate cell growth and repair. Fantastic for anti-aging, great for skin regeneration, peptides.
Yep.
We know these are amino acid chains. They help with that skin elasticity, collagen boosting, scar healing.
Yep.
So, a lot of patients will say after a surgery, what can I do for the scarring?
Yes.
Anything with peptides, that's going to be a great starting point. Fermented ingredients. This was something when I was reading more about these regenerative, biotechnology ingredients, these products. I don't know that I really even knew that was the title that these properties had, these fermented ingredients.
Yeah.
Basically, they ferment products like rice, mushrooms, algae, and it makes them more powerful. And like to your point you said, you do see that in like SkinCeuticals, the hyaluronic acid, the HA intensifier, licorice root, it's purple rice. But man, it is one heck of a moisturizer.
Yes.
It is such a great
so
hydrator.
It's
right?
so good. Yeah.
So I think it's just interesting looking at these products and seeing, what do they come from? But more importantly, recognizing that there are differences between them.
Right.
And I think, it's good for patients to recognize that these are products that can be very beneficial, but they are different from one another.
They are. Absolutely.
It's funny, Neocutis. Do you remember Neocutis?
I do. I remember when I started at my last office, a decade ago, and Neocutis was a line that we carried, and I remember you talking to me about it then, and it blew my mind.
Right?
Yeah.
So Neocutis, it's interesting because it was one of the first, in my experience, one of my first, products to talk to patients about that was a human growth, it has human growth properties in it. But it was interesting because this product in particular, they extracted the cells from human foreskin and they use it to make these growth factors.
Yep.
And it was crazy because patients, they hear growth factor and that's
they're
pretty
in.
much all that they're in, right?
They don't care.
And they think, oh, this is a fantastic product. And it is. It does work well.
Right.
But again, the company, when you deep dive into their website, I was actually just looking recently, you don't really see much about where does it come from. Doesn't mean it's a bad thing, but it just, information is important.
And transparency.
Transparency is important. So what's interesting is back in 2003 when Neocutis launched their product, it hit the market, patients loved it, people could see the results, people were buying into it. And then the information started coming out and people were like, oh, wait a minute, what's in this? What am I putting on my face?
Yeah.
So it was funny because they actually launched a secondary product that was more of like an alternative to the human growth factor, and it was like a lab-made product.
Yeah.
And they had an entire secondary line because people were not comfortable with what they were using. But now people are much more comfortable. That secondary line has gone away.
Yes.
But again, still at the same point, it's important to know what you're putting on your face and to know how is it helping, what's it derived from, plant-based, human-based. Those are important questions, I think, to ask.
Absolutely.
Microbiome. That's another trend in dermatology.
Very trendy.
Let's talk about that.
There's a lot of discussion now about the gut-skin relationship. So it's an interesting topic. I think we're always learning. But from what we've at least learned now, there's a really strong link between the two, the skin-gut biome. Prebiotics would be, so certain products like BioJuve, we'll talk about here in a few minutes. There are prebiotics, probiotics, and then postbiotics. So prebiotics would be what you feed the bacteria. Everyone has normal, healthy bacteria on the skin, in the gut. It's totally normal.
You need to have it.
Yes.
That's
people are
actually
grossed out
what
by that. We need it.
we
It helps
do.
to keep everything nice and happy.
In fact, that's what a microbiome actually is.
Yes.
It's the compilation of all of these
bacteria,
these things that grow on our skin normally and should be.
So the prebiotics would be what feeds the bacteria.
Yeah.
Probiotics are the actual bacteria themselves. So depending on what products you're using, and again, I know we'll talk about BioJuve, but that kind of lets you know where exactly you're going to see the benefits and what exactly the topical serums, whatever it is you're using, where it's going to take place.
Yeah. BioJuve is definitely something that was a new product for me back a year or two ago. We incorporated it into our practice.
Right.
Great as a product to use post microneedling.
And with filler. Post filler.
Yeah, and with filler. Yeah. So it speaks to the whole process of the microbiome. It's putting those prebiotics, those probiotics onto the skin. Talk a little bit about BioJuve and how it works.
So there are a few different steps with the BioJuve products. We should have brought one in here.
I know, we should have.
Well, come see us at the office, whichever camera, and we'll go through the products. But there's a couple serums. There's the serum, and you did...
it's like a 3-step.
Right.
A 3 or 4-step, depending on if you add the cleanser.
Right.
But it's, you put the product on, you have to spray it, it activates the
biome.
It activates the whatever's in it, the probiotic.
Right.
And then, it helps to really feed the skin and it helps to repair that skin barrier. So especially when we're doing things that disrupt the skin barrier, like microneedling. Yeah. It creates this inflammatory situation on the skin. And when you're using something to help repair that microbiome, decreases that inflammation, helps with healing, and patients have a much better outcome.
Yep.
So I love that. Definitely, with microbiome, talking about that too, with things that we see like atopic dermatitis. I think that there is so much happening in that arm of dermatology right now because, psoriasis had its day and still is, where all of these biologics are coming out onto the market. Atopic dermatitis is really kind of right behind it. So we're seeing so many new drugs, topicals and systemics coming out onto the market.
Right.
But, I think that there's this huge push for helping to regulate the microbiome, especially in atopic patients.
Because they don't have the skin barrier.
They don't. Their skin barrier it does not know how to work properly. Right. So products like CeraVe, fantastic ceramide, great fatty acids, help to restore that moisture.
Right.
Sort of the way I describe it with patients that have eczema, it's like your skin's a tarp. And when you have eczema, it's like having holes in that tarp and water is constantly escaping, right? So if you can use products that help to pour, water back under the tarp and then you're plugging it, it's a great way to help restore that skin barrier and restoring that microbiome.
I always say it's a brick wall. I love to hear different analogies.
I like that one too.
So I always describe it as a brick wall, and when you have products that have ceramides in it, it's kind of like and I'm not a bricklayer, but the stuff that helps
the mortar.
The mortar. But it helps to act like the mortar to hold the bricks together. If you don't have that mortar and there are all these cracks, then things can get in, which disrupts your foundation. That's where you get like viral infections, molluscum warts, staph, bacterial infections. So I love that analogy.
Yeah, keeping things out that need to be out, letting things in that need to be in.
Yep.
For sure. Personalized skincare. That's another trend.
Yes.
So talking about AI, this is something I'm actually excited to talk about because I think that a lot of people get really nervous and scared when you talk about how artificial intelligence can be helpful, how it can be harmful. It certainly can be both.
Absolutely.
So what we see in dermatology, what are some areas that you see AI kind of coming in?
I mean, we were discussing earlier, if you, and I know you've done this too, if we have a diagnosis in mind and we just need to find quick articles on what's going to back up the diagnosis, or even how can I break this down for a patient to make it make sense?
Yeah.
You can type that into something like ChatGPT and it gives you a full tutorial on exactly what to say and printouts and articles. And it's just, it in that instance is a really good resource that we can share with patients.
Yeah. And I definitely think, specific to diagnosing too, I think that there are obviously apps that are coming out where you can download it on your phone and use it to take a picture of a mole.
Right.
Obviously, with that, I have a lot of concerns.
Mixed feelings.
Yeah. I mean, you're counting on the patient to take a high quality photo. The app itself has to be able to work properly.
Right.
But I do think that there are things that are coming out where you can maybe attach a dermatoscope, let's say, to your phone, and clinically, it can help us as the clinicians to diagnose things properly. We can take a picture. It can be used to, identify things that stand out on the skin lesion, kind of like what we see with our eyes through the dermatoscope.
Right.
It's a way of utilizing that mechanism a little bit better for us in the office. So I think that that's something that can be helpful. I think with AI too, it's interesting to see how, it can be utilized cosmetically. Taking a patient photo and using AI to generate, okay, so if we do some lip filler, if we do one syringe, here's what it'll look like. If we do 2 syringes in your cheeks, here's what that can look like. And I think it can give the patient a really good understanding too of outcomes.
Right.
So that the patients can be a bigger part of the treatment plan.
Yes.
You know what I mean? Because otherwise, they largely depend on us. Patients don't always know, okay, half syringe, full syringe, 2 syringes in the cheeks.
Right.
So I think that would be a good way to really show the patient, here's what you can expect, and then let them be a part of the decision-making process too. So I think that it can certainly be positive in that way. Also too, I thought it was interesting looking at, kind of going back to what I was saying, the attachment that, they're looking at in terms of being able to scan skin cancers, melanomas in particular. It was actually showing a recent study that it had about an 81, which this is kind of a wide range, but an 81 to 99% accuracy.
It's a wide range.
It is a wide range, but either way, anything over 80%, I was like,
pretty good.
That's not bad.
Yeah.
So, I definitely think that AI, I think there can be resistance.
Right.
I think that there are concerns about it maybe doing too much or us not using our clinical skills as much.
Or taking the job.
Or taking the place.
Our jobs in healthcare.
And I don't think that that's where this is heading.
Agree.
But I think that you can resist it, or you can also look at it in a way of how can we incorporate it in a safe way and a way that truly is beneficial for us as providers, but also for patients too.
Yeah, utilize the resource.
Utilizing resources is so important. And I think
it's a great tool. It's not a replacement for us as clinicians, but it is a great tool. One thing, and I know we talked about this earlier too, one downfall, and this is across the board, just in healthcare, but especially with AI, is we don't have enough skin of color examples. Most of, and I mean, I've been in derm for a decade. Most of the textbooks that we have, if you Google lichen planus or any kind of diagnosis,
psoriasis,
the diversity is incredibly minimal. There's been a push lately, which I appreciate because we see everybody. And I never want to feel like somebody is getting different care because there's more resources. So there's been a good push lately on getting adequate data on everyone. But I do think AI still has a way to go with that.
That was actually one of the limitations in the study that I was looking at was the fact that it struggled sort of deciphering darker pigmented areas within the lesion versus just the darker pigmentation to the skin. So, yeah, I definitely think that there's more to be had there for sure. More improvements. Another area with AI that I thought was interesting was using it to customize skincare plans. So using it as a way to sort of scan a patient's face, see, okay, are we looking at acne-prone skin, redness, oiliness, dry skin? And then it helps you to customize a very, very personalized skincare treatment plan for a patient. Because with our eyes, we can look at patients
Right.
and know just visually, okay, you need this or you need that.
Right.
But this can get, real specific for patients. So I do think that it can be utilized in a way that really is positive for patients that can have really good outcomes too.
Mm-hmm.
Let's talk about diet trends.
Okay.
Diet and skin.
Okay.
I found it to be very interesting. American Academy of Dermatology 2025 meeting.
Mm-hmm.
They had a focus area on how diet and lifestyle influence skin health.
Mm-hmm.
This is actually interesting to me because diet in dermatology is really not something that has gotten much attention over the
Right.
years.
Right.
And now I think so many people are a little bit more interested in what am I putting into my body and how is it negatively affecting
Right.
me or
Absolutely.
positively affecting.
Right. Yeah.
What are your thoughts on that?
I think, and we may have touched on this a little with the acne podcast, but I definitely think it's still up and coming. We're learning a lot. But the Mediterranean diet, for example, is beneficial for so many things. Skin health, heart. They've done studies on Alzheimer's patients, and I know we've also talked about cancer patients, prostate cancer. There are so many different diagnoses that benefit from the Mediterranean diet. So I think we're still learning.
Yeah.
But the high fat content in the Mediterranean diet, olives, olive oil, that's beneficial for the skin.
It specifically went into detail in this study talking about the Mediterranean diet, how it can help to make biologic treatments for psoriasis more effective. So
you're decreasing inflammation.
You are.
Yeah.
Absolutely, yes. Whole grains, beans, fruits, vegetables, fish, all of these things, these are pretty much what are in that diet.
Yes.
I have to say, I actually did the Mediterranean diet back several years ago.
Oh, did you?
Yes.
How'd it go?
It was really good. I enjoyed it.
Yeah.
But man, it was so time consuming.
Really?
I had to cook so much.
Mm.
I literally one morning woke up and it was breakfast and I was in there boiling shrimp for lunch. And,
Oh, God.
And I was like,
yeah.
I can't.
Yeah.
This is too much.
Buy it already boiled at
ready-made.
Publix.
Yes.
Yeah.
And ready-made
Little
now.
pro tip.
I was doing that and I thought, this is just not conducive to my lifestyle at all. As much as I want to do it, I just can't.
Yeah.
But now you can buy it already made. So that certainly is helpful. Advanced melanoma. It said the deadliest form of skin cancer, a diet rich in fiber from fruits, vegetables, whole grains. These enhance the effectiveness of immunotherapy.
Yes.
Talk a little bit about what immunotherapy is for these patients. What's happening with immunotherapy?
So basically, they're going after your, for lack of better terms, your immune system. We're trying to target the skin cells that are damaging and build up the skin cells that are beneficial. And I looked that up as well because I a while ago saw that you want to avoid probiotic supplements, which I found interesting because you always hear you want to take a probiotic. But because a probiotic is that live bacteria, it can actually complicate the immunotherapy and make it less effective because it's trying to work on the bacteria rather than doing the benefits that you actually want it to achieve.
Yes. So yeah, it's important to know, diet-wise. Obviously, there are things that are beneficial.
Right.
There are also things that can be harmful or not as beneficial, I guess is the way to say it. Same for acne. We see patients all the time on Accutane, recommending foods that are high in omega-3s.
Right. Or taking a fish oil.
Or taking the supplement. Yeah, that can be so helpful for these patients. It helps them to absorb the medicine properly. In fact,
with side effects.
It does help with side effects, but just the absorption part of it. We know that Accutane, it has to have fat to bind to. So we see a lot of teenagers, and teenagers, while they don't always have the healthiest diet, they're not always getting the fat that they need in their diet for this medicine to absorb properly. So I actually do spend quite a bit of time with my Accutane patients talking about what are you eating?
Right.
Are you eating fat? If you're not getting enough fat, you need to make sure you're taking a supplement of omega-3s to help it absorb better. Makes a difference.
I always say you don't have to eat 3 steaks or 3 cheeseburgers to get your fat content. You can have a spoonful of almond butter if you're not allergic, peanut butter, half an avocado.
Walnuts.
But you want those omega-3s.
Yeah. What about GLPs?
such a hot topic right
Isn't
now.
it, though?
It really is. For so many reasons, but the inflammatory benefits or anti-inflammatory benefits that you get from a GLP-1 is insane.
Right.
For so many different, like, areas of the body, joints, but also skin. It decreases that insulin resistance, helps with insulin resistance, decreases androgen activity. So a lot of people will notice that they'll have less oily skin, which is big, which can also help with acne, less acne on the skin.
PCOS patients.
PCOS, HS.
Definitely helps there, yeah. HS. So diet is a really, really big part of the skin. And I love so much that we're seeing more and more coming out about what do you need to be eating? What do you need to be avoiding? Because that is, even though it's, it doesn't seem like a huge part of the treatment plan, it absolutely can be.
Oh, absolutely.
What are do you know any other trends? Anything else that that you can think of that patients are coming in asking about, wanting?
All the TikTok trends.
Oh, there's so many.
There are so many. And I even got a TikTok. I had to do some, what is it, QC, quality control?
Quality control.
So I created a TikTok just for this reason. But I would
Which
always
I love your TikTok.
Thanks. I have patients come in and they'll say, like, oh, I saw this on TikTok, and it's nothing we would ever do, ever. Like, I've heard of the toothpaste.
Yes.
I put toothpaste on my pimples, or lemon juice.
Oh.
Which,
For what?
Skincare.
Oh, gosh.
Yeah. And in the summer months, which we're not in now, but any kind of acidic fruit juice on the skin.
Horrible.
Going into contact with the sun, phytophotodermatitis.
Yep.
I mean, there are so many different. Just say no.
Yes.
Just say no.
I was telling you just the other day, my daughter, she was telling me about skin marathons. And I was like, what in the heck is that?
Never heard of it.
Yes. Now, we've been talking about good trends. These are the not good trends.
These are the what not to
These
do's.
are the what not to do's. But yeah, I was like, what is a skin marathon? And she said, well, it's basically where you line up all of your products that you have in your bathroom, and you start at one end and you apply them all. You put them all on.
The craziest thing I've ever heard.
I was like, why would you do that? And she was like, well, so that they can all work at the same time.
It's not how
and I'm like, that is not a thing.
No.
That's just not even a thing. You're wasting products.
And getting contact dermatitis because you're having reactions from products that shouldn't be together.
It's crazy.
It is crazy.
The things that are out there, it's not all bad, but man, some of it you really just,
I have one.
What?
The DIY Botox, DIY filler.
Stop. I cannot with that.
We were
watching,
mortified.
Just the other day, we were watching a video of a lady dissolving her own filler.
Mortified.
I can't believe that is happening.
No, which I know I'm overly cautious. I live there. But I've done this for a decade.
Yes.
You know how serious I take any kind of education, filler training, injections, anything. I mean, I live on the side of caution.
You're very cautious.
And
that's a good thing.
I think so. It's worked out so far.
Yes.
The thought of even me going home and trying to do my own filler in a mirror or in a cell phone to make a TikTok about it.
I know.
Terrifying.
I can honestly say I've never injected myself.
No.
I can't imagine doing that even with training.
Terrifying.
Right.
And they haven't had training.
Literally haven't.
Like
you buy it online, probably from overseas. It comes to your house, and then you just go. You just go. Yeah.
Good luck.
It sounds so dangerous.
Yeah.
Not to mention the fact, what is even in the vial that you're injecting?
Yes.
Not only do you not know how to inject it, but what are you even injecting?
Yes. No clue.
At-home treatments, at-home microneedling, at-home dermaplaning, all of that. Although dermaplaning, that's not so bad. But at-home microneedling, same thing. Staph infections, you're piercing down into the skin.
And most of them aren't like the stampers, the at-home, like where
the
you
rollers.
don't get the depth. It's the rollers where you have those track marks all over your skin.
Right.
Hyperpigmentation.
Yeah.
I mean,
Scarring,
yes.
Infection.
It's
just terrible.
It is terrible.
TikTok it's fun. It can be informative.
It can be.
But oh my gosh.
It can also tell you what not to do.
You're exactly right. So we're going to do some rapid fire true false.
Okay.
So I have to say, speaking of AI, Had some chat GPT help with some of these.
Good.
I have to say that because some of these questions are actually like, what in the world? So prepare yourself.
Okay.
Are you ready?
Nervous. No.
Don't be nervous.
Okay.
True, false. This one's
Okay.
easy.
Okay.
You can shrink your pore size with cold water.
False.
Yes, that's
I feel
exactly
like this is
right.
like a speed test or something. Do I have to answer in like 3 seconds?
Yes.
Okay. It's like Jeopardy.
True, false.
Okay.
Dark skin tones do not need sunscreen.
False.
That's right. True, false. Skin renews itself every 28 days.
True.
That's
Skin
right.
cell turnover. Yeah.
Yes. I was actually surprised it was 28 days.
Do you think longer or shorter?
I would have expected maybe a little longer than 28 days just in thinking about, different mechanisms of how medicine,
Yeah.
certain products work on the skin. So I was actually surprised that one was 28 days. That one I would
Unless you
have
have
gotten.
psoriasis.
Well, that's
Then
true.
It's much quicker.
That is very true, which is the whole premise of what happens with
It
psoriasis,
is.
accelerated skin cell.
Yep.
True or false? Natural or organic skincare products are always best.
False. You know what else is natural?
What?
You know.
Poison ivy.
Poison ivy. The worst rash I've ever had in my life.
Literally.
You can get it from your dogs, and I have 2 dogs, and I'm obsessed with them.
Yes.
But when I had puppies, because I'm never not going to snuggle them,
Right.
their sweet little faces, and I had like tail lines.
I will
across
never
my
forget
neck.
when
It
you
was
had that.
awful.
It really was.
Oh my gosh.
I have to say, out of all of the cases of poison ivy I think I've ever seen,
I win.
you do.
Yeah, thank you.
It was really bad. Okay, let's see. True or false?
Okay.
You should exfoliate every day for glowing skin.
No, you'll peel your face off.
Literally, yeah. Talk about raw skin.
No,
You can still sunburn on a cloudy day.
absolutely.
Mm-hmm.
Most sunburns that I see in office doing a skin exam, or if they come in because they've blistered,
Yeah.
they're like, I was at the lake, but it was cloudy. I had no idea. The sun is still there.
I can honestly say one of the worst sunburns I ever had was when I was on Accutane.
No.
Which is, you're going to sunburn with
Terrible.
Accutane just
Yes.
at baseline,
Yes.
but I had gone outside maybe for like an hour. It wasn't long.
Yeah.
It was a very cloudy day.
Yeah.
I was so sunburned.
Mhm.
So yeah, definitely still sunscreen on a cloudy day.
Yep.
You actually said this one a second ago.
Okay.
Applying toothpaste onto acne can help clear the bump.
I would say no.
That's a hard no.
It's a hard
Contact dermatitis
Yes.
definitely will happen with that. Your dermatology provider can tell if you sleep on your left or your right side.
True.
That is true. Wow.
That is true.
How do we know that?
So you have natural lines like smile lines, crow's feet. You have all the natural lines that you would on your face, but if you do sleep on the side, you get an unnatural line on where
see
your
verticals.
cheek,
Yep.
whichever
And
side
it
you sleep on.
Looks like that side of the face is just going to be naturally lower.
Mhm.
So like
With hooding, eyelid hooding, you see a little bit more on that side if you have hooded eyelids.
I feel like sometimes the mouth can even look a little bit lower. Cheek can be lower. That whole side that you sleep on is lower. But it is so hard to sleep on your back. Are you a back sleeper?
Hard. I try to be.
Really?
I have like pillows. Well, I have pillows and dogs,
You have
which
to
are
barricade.
basically giant pillows. And I will try to like shove myself into one position, and then I have one dog on this side, one dog on this side, so I can't really roll over. And then now a kitten like attached, like I have
Like
a
a
neck
little cat
scarf.
scarf.
Yeah, a little kitten scarf. So I don't move much anymore.
Yes.
It's been great.
You're
for
packed
skincare.
in.
Yeah.
It's great for anti-aging.
I recommend it. Yeah.
That could be an anti-aging
Yeah,
trend.
it is.
The dust in your house is mostly made up of dead skin cells. True or false?
Oh, true.
That is true.
It's gross, but
Right.
it's true.
Ugh.
Yeah.
The average person sheds about a pound of skin a year.
Ew.
True or false?
I mean, I could see that.
It's
being
true.
Yeah.
A pound of skin a year.
Yeah, that's gross.
That's a lot.
Yeah. But normal.
But normal. Yeah, apparently. A tattoo can change color based on your blood sugar or your UV exposure. This one was new for me.
Interesting.
True or false?
I mean, based on UV exposure, I could see that for sure because it's going to make it darker, more tinted, or burn. You can still get
Fade.
damage.
Fade
Yeah.
the pigment.
So, yeah, true.
It was true. I need to look into that one more because that one was interesting. The fact that the pigment in a tattoo can change based on your blood sugar.
Interesting.
That was
I mean,
new
you
for
get
me.
a little pallor if you have a low blood sugar.
I mean, true.
So I could see that, like it kind of fading.
Yeah.
Yeah.
I thought that was interesting.
It is.
You can sunburn through glass.
True.
Yeah, that is true. driving.
In
So
a
those
car.
hands,
Yep.
keep those hands young because they're up in that windshield.
Yes. The majority of aging, basically, people will put sunscreen on their face, forget their neck and chest. Chest always gets the sun, and then the driving hands.
Yeah, that's true.
So they make driving gloves.
I was just about to ask you, do you have driving?
Yes, I do.
I knew you did. You're so compliant.
I try to be.
True or false? And if you missed this,
Oh, no.
at-home injectables are a great idea.
I'm going to go with false.
You're right.
You should come see us at the DERM Center.
Literally, yes.
Absolutely not.
The more expensive the product, the better it works.
No.
Right.
No. I mean, there are some medical grade skincare products that I say it's definitely worth splurging on. But then I also just love a CeraVe cleanser.
What is worth a splurge?
I think
Which ones do you think?
Vitamin C,
Mm-hmm.
I'm obsessed with.
Yeah.
And SkinCeuticals does the research behind. They back up what they
do.
claim, which I appreciate.
Yeah.
But a vitamin C, a good vitamin C, and then I like a good retinol.
Mm-hmm.
I know you love your HA intensifier.
I do.
You do?
Anybody who's ever listened to this podcast, followed my social media, if you know me at all,
yes,
you know that
You
is
want
my
the HA
favorite. I
intensifier.
do.
Yeah.
It is such a great dermal hydrator.
Yeah.
I literally put it like I could bathe in it.
Yeah. You do
know?
love it.
I know.
Mm-hmm.
I'm with you. I think that there are certain products that are worth investing, and that's
Right.
even what I tell my patients. Cleansers, moisturizers,
Right.
sunscreens, for the most part, get those at the pharmacy.
Yeah.
To your point, hyaluronic acid, vitamin C, retinols.
Yep.
Those are good products to invest in for sure.
Absolutely.
Going to Sephora and just spending $1,000 on stuff that you pick off the shelf because it's branded well.
Right.
That is not how you make a selection.
That's a good point because in just the skincare world in general,
Yeah.
it's based off of a business marketing plan rather than like CeraVe. I mean, it's CeraVe. I don't know that the packaging has changed since forever, or Cetaphil. But it's good. It's what we recommend. It doesn't have like the cute little bubbles and the pink and the whatever.
The elephant.
Right, the elephant. But all of those products are from a business marketing standpoint.
That's right.
To grab the consumer. So it's not like they necessarily it's what's best for your skin. It's just what's going to get your attention and you're going to want to buy it.
That's exactly right. In fact, I kid you not, I had a patient tell me recently, we were talking about SkinCeuticals, and I was like, I think this would be a good one for you, and I'm holding it, and she's looking at it, and she was like, those bottles are just not cute. And I was like, I mean, she's not wrong, but
it's what's on the inside that counts, okay?
literally the case. And I was like, I mean, you're putting it on your face.
Yeah.
No one is seeing the bottle,
No.
but it's nice when they do look nice, and it can complement your decor or whatever. But
would you rather it look nice
or
and
work?
not do anything, or I mean, it doesn't look bad. I think SkinCeuticals does
It's a
pretty
pretty
good
little
with their
glass
marketing.
bottle.
Yeah.
I know. I totally
That's so
agree.
funny.
But it was funny because I thought, I mean, that is the mind of a consumer. And to your point, I mean, it's a huge industry, right? And I mean, you can only have so many vitamin C's on the shelf.
Right.
And unless you're, someone in the field of dermatology or aesthetics and you're standing there, you don't really know one to the next how they're different.
Yeah.
So they have to market them in a way that makes them
your
attractive on the
attention.
shelf, right?
Mm-hmm.
It's wild, isn't it?
It is crazy.
Other trends? You have anything else?
Oh, I should have made a true false for you.
I know. You should have.
Man.
I had to hide my last page. So
I know.
you
It
wouldn't
stressed me out.
I told you would get them all right.
Oh, my gosh.
The 1 pound of skin a year, that one really that. I'm stuck on that one.
Yeah.
I thought that would be false when I read that on ChatGPT, and I was like, okay, 1 pound. Wow. It's crazy.
Yeah.
So, definitely these are things that I think are important. These are things that, hopefully people listening today can take something from it. And if there are any questions or if people, need guidance when it comes to what products to use or, their own thoughts on current trends, they want to talk to us about them, always welcome to come and see us at the DERM Center. Thank you for being here today.
Thanks for having
This was fun.
me. It was fun.